Good day, this is Nurse Marcia. Welcome to Part 4 of our Pediatrics NCLEX-RN Series, where we'll tackle high-yield pediatric hematologic disorders like anemia, sickle cell disease, and leukemia, with a focus on NCLEX next-generation NGN strategies. Missed Part 3 on infectious diseases? The link's in the description. Let's dive in and get exam ready. Question 1. A 2-year-old child is diagnosed with iron-deficiency anemia. Which food should the nurse recommend to the parents to improve the child's iron levels? A. Whole milk. B. Boiled spinach. C. Apple slices. D. White bread. Answer: B. Boiled spinach. Rationale: boiled spinach is an excellent source of non-heme iron, which is essential for hemoglobin production in red blood cells. Non-heme iron from plant-based sources is better absorbed when combined with vitamin C-rich foods. Whole milk, choice A, is not recommended because it is low in iron and can interfere with iron absorption due to its high calcium content. Excessive milk consumption is also a common cause of iron deficiency anemia in young children. Full slices, choice C, and white bread, choice D, do not contain significant amounts of iron and are therefore not helpful in correcting anemia. Question 2. Which laboratory findings are consistent with iron deficiency anemia in a pediatric patient? A. Low hemoglobin levels. B. High respiratory count. C. Microcytic hypochromic red blood cells. D. Elevated serum ferritin levels. E. Increased total iron binding capacity (TIBC). Answer: A, C, E. Rationale: A. Low hemoglobin levels. Iron is a critical component of hemoglobin. In iron deficiency anemia, the lack of iron leads to reduced hemoglobin synthesis, causing anemia. C. Microcytic hypochromic red blood cells. These are characteristic findings in iron deficiency anemia. Microcytic refers to smaller than normal red blood cells, and hypochromic refers to cells that appear pale under a microscope due to reduced hemoglobin content. E. Increased total iron binding capacity (TIBC). When iron stores are depleted, the body increases the production of transferrin to capture and transport any available iron, resulting in a higher TIBC. Incorrect options: B. High respiratory count. This is seen in conditions where the bone marrow is compensating for anemia, such as after bleeding or in hemolysis, but it is typically normal or low in iron deficiency anemia. D. Elevated serum ferritin levels. Ferritin reflects iron storage in the body. In iron deficiency anemia, serum ferritin is usually decreased, not elevated. Question 3. A child with sickle cell disease presents with severe abdominal pain, fever, and difficulty breathing. What complication should the nurse suspect? A. Acute chest syndrome. B. Stroke. C. Splenic sequestration. D. Vaso-occlusive crisis. Answer: A. Acute chest syndrome. Rationale: acute chest syndrome is a life-threatening complication of sickle cell disease characterized by symptoms such as fever, pain, especially in the chest or abdomen, and respiratory distress. It results from sickled cells obstructing blood flow in the pulmonary vasculature. While stroke, choice B, and splenic sequestration, choice C, are complications of sickle cell disease, they do not typically present with respiratory symptoms. A vaso-occlusive crisis, choice D, can cause pain but does not directly cause breathing difficulties, distinguishing it from acute chest syndrome. Question 4. Which interventions should the nurse prioritize when managing a child with a vaso-occlusive crisis? A. Initiating oxygen therapy. B. Administering 4 fluids. C. Applying cold compresses to painful areas. D. Administering opioids for pain management. E. Encouraging physical activity to promote circulation. Answer: A, B, D. Rationale: A. Initiating oxygen therapy. Oxygen alleviates hypoxia and prevents further sickling of red blood cells, a key intervention in a vaso-occlusive crisis. B. Administering 4 fluids. Hydration decreases blood viscosity, improving circulation and reducing the risk of additional vaso-occlusion. D. Administering opioids for pain management. Pain from ischemia is a hallmark of vaso-occlusive crises and requires prompt and effective analgesia. Incorrect options: C. Applying cold compresses. Cold causes vasoconstriction, worsening the obstruction and ischemia. Warm compresses are preferred to relieve pain and promote circulation. E. Encouraging physical activity. Rest is critical during a vaso-occlusive crisis, as activity increases metabolic oxygen demand, exacerbating hypoxia. Question 5. A 5-year-old with hemophilia presents to the emergency department with swelling and bruising around the right knee after a minor fall. What is the nurse's priority intervention? A. Administer desmopressin DAFs. B. Apply ice to the affected joint. C. Elevate the affected leg. D. Administer factor VIII replacement therapy. Answer: D. Administer factor VIII replacement therapy. Rationale: priority in managing bleeding in hemophilia is to replace the missing clotting factor, factor VIII in hemophilia A or factor IX in hemophilia B, to stop the bleed. Applying ice, choice B, and elevating the leg, choice C, are adjunct measures to reduce swelling and bleeding but are secondary to clotting factor replacement. Desmopressin, choice A, is used in mild cases of hemophilia A to promote the release of stored factor VIII, but is not effective in severe cases or in hemophilia B. Question 6. A child with sickle cell disease is hospitalized for a vaso-occlusive crisis. Which findings would indicate the need for immediate medical intervention? A. Temperature of 102.2 degrees Fahrenheit, 39 degrees Celsius. B. Oxygen saturation of 95%. C. Severe pain rated 9/10. D. Respiratory rate of 30 breaths per min. Answer: A. Temperature of 102.2 degrees Fahrenheit, 39 degrees Celsius. Rationale: a high fever in a child with sickle cell disease is a red flag for infection such as sepsis, which is a leading cause of morbidity and mortality in these patients. Immunocompromise due to functional asplenia puts the child at higher risk of severe bacterial infections. Oxygen saturation of 95%, choice B, is within normal limits for most patients with sickle cell disease. Pain, choice C, and mild tachypnea, choice D, are expected during a crisis but are not immediately life-threatening compared to fever. Question 7. A nurse is educating the parents of a child with iron-deficiency anemia about dietary changes. Which statements indicate the need for further teaching? A. I'll serve oatmeal with orange juice for breakfast. B. I'll give my child milk with every meal to help build strong bones. C. I'll add lean meats and green leafy vegetables to meals. D. I'll encourage snacks like dried fruits and nuts. Answer: B. I'll give my child milk with every meal to help build strong bones. Rationale: milk is low in iron and its high calcium content interferes with the absorption of dietary iron. While milk is important for bone health, excessive consumption can worsen iron deficiency, particularly in toddlers. The other options support improved iron intake or absorption and reflect accurate understanding. Question 8. A child with hemolytic uremic syndrome (HUS) has decreased urine output and generalized edema. What should the nurse expect as the primary treatment approach? A. Antibiotics to eliminate the causative agent. B. Administration of diuretics to reduce edema. C. Supportive care including fluid management. D. Plasmapheresis to remove toxins. Answer: C. Supportive care including fluid management. Rationale: HUS is primarily managed through supportive care, which includes close monitoring of fluid balance, maintaining electrolyte levels, and managing acute kidney injury. Antibiotics, choice A, are avoided in E. coli-associated HUS because they can worsen toxin release. Diuretics, choice B, may exacerbate kidney injury if not carefully managed. Plasmapheresis, choice D, is reserved for severe or atypical HUS. Question 9. A 3-year-old diagnosed with acute lymphoblastic leukemia, ALL, is undergoing chemotherapy. What is the nurse's priority when caring for this child? A. Encouraging a high-calorie, high-protein diet. B. Preventing exposure to infections. C. Monitoring for signs of internal bleeding. D. Assessing for signs of tumor lysis syndrome. Answer: B. Preventing exposure to infections. Rationale: Children with all receiving chemotherapy are immunocompromised due to bone marrow suppression, placing them at high risk for infections. Preventing exposure to pathogens is critical. While monitoring for internal bleeding, choice C, and tumor lysis syndrome, choice D, is important, infection prevention takes precedence due to its immediate life-threatening potential. Encouraging a healthy diet, choice A, supports recovery but is secondary to infection control. Question 10. Which findings should the nurse expect in a child with neuroblastoma? A. Enlarged abdominal mass and weight loss. B. Petechiae and mucosal bleeding. C. Bone pain and frequent fractures. D. Bloody diarrhea and dehydration. Answer: A. Enlarged abdominal mass and weight loss. Rationale: neuroblastoma, a malignancy of the sympathetic nervous system, often presents with an abdominal mass, weight loss, and systemic symptoms like fever and fatigue. Petechiae and mucosal bleeding, choice B, are more characteristic of leukemia. Bone pain and fractures, choice C, are associated with bone metastases but not the initial presentation of neuroblastoma. Bloody diarrhea, choice D, is a hallmark of hemolytic uremic syndrome. Question 11. The nurse is caring for a child with hemophilia who reports joint pain and swelling. Which interventions are appropriate? A. Administering NSAIDs for pain relief. B. Elevating the affected limb. C. Applying ice packs to the joint. D. Administering factor VIII replacement therapy. E. Encouraging passive range of motion exercises. Answer: B, C, D. Rationale: B. Elevating the affected limb, reduces swelling and promotes venous return. C. Applying ice packs to the joint, controls bleeding by inducing vasoconstriction. D. Administering factor VIII replacement therapy, addresses the underlying clotting deficiency to stop the bleed. Incorrect options: A. Administering NSAIDs. NSAIDs increase the risk of bleeding and are contraindicated. E. Encouraging passive range of motion exercises. Rest is essential during active bleeding to prevent further joint damage. Question 12. True or false? In children with sickle cell disease, dehydration is a common trigger for vaso-occlusive crises. Answer: true. Rationale: dehydration increases blood viscosity, which promotes red blood cell sickling and vaso-occlusion. Hydration is a critical preventive and therapeutic measure in sickle cell disease management. Question 13. A 6-year-old with iron-deficiency anemia is prescribed oral ferrous sulfate. What instructions should the nurse include in the discharge teaching? A. Administer the medication with milk to reduce stomach upset. B. Use a straw to prevent staining of the child's teeth. C. Expect black stools as a sign of gastrointestinal bleeding. D. Give the medication right before bedtime for better absorption. Answer: B. Use a straw to prevent staining of the child's teeth. Rationale: liquid iron can stain teeth, so using a straw minimizes contact with the teeth. The medication should be given with vitamin C-rich fluids, not milk, choice A, as calcium inhibits iron absorption. Black stools are a normal side effect, not a sign of bleeding, and iron is best absorbed on an empty stomach, not before bedtime. Question 14. A child with leukemia is receiving chemotherapy. Which symptom requires immediate intervention? A. Fever of 100.4 degrees Fahrenheit 38 degrees Celsius. B. Loss of appetite. C. Bruising on the arms. D. Fatigue after activity. Answer: A. Fever of 100.4 degrees Fahrenheit 38 degrees Celsius. Rationale: fever in a child undergoing chemotherapy is a medical emergency, as it may indicate neutropenic fever and sepsis. Immediate intervention is needed. The other symptoms, while concerning, are common side effects of leukemia or chemotherapy and do not require urgent intervention. Question 15. True or false? Vaccinations, including live vaccines, should be delayed in children undergoing chemotherapy for leukemia. Answer: true. Rationale: live vaccines are contraindicated during chemotherapy due to the child's immunosuppressed state, which increases the risk of developing an active infection from the vaccine. Vaccination schedules should be adjusted based on the child's treatment plan and immune recovery. Question 16. A 4-year-old child with a history of hemophilia is admitted with swelling and pain in the left elbow after a fall. What is the nurse's priority intervention? A. Administer 4-factor replacement therapy. B. Apply a warm compress to the affected joint. C. Encourage the child to move the joint gently. D. Administer ibuprofen for pain relief. Answer: A. Administer 4-factor replacement therapy. Rationale: in hemophilia, bleeding into joints, hemarthrosis, is common after trauma and can cause severe complications if untreated. Administering the deficient clotting factor, factor 8 or 9, is the primary intervention to stop bleeding. Warm compresses, choice B, are contraindicated as they promote vasodilation and worsen bleeding. Movement, choice C, should be avoided during active bleeding to prevent further damage. NSAIDs like ibuprofen, choice D, increase the risk of bleeding and are not recommended. Question 17. A 7-year-old with sickle cell disease is experiencing a vaso-occlusive crisis. Which nursing actions are appropriate? A. Administering oxygen for hypoxia. B. Initiating 4 hydration. C. Applying cold compresses to painful areas. D. Administering opioids as prescribed. E. Encouraging ambulation to improve circulation. Answer: A, B, D. Rationale: A. Administering oxygen for hypoxia. Hypoxia exacerbates sickling and supplemental oxygen improves tissue perfusion. B. Initiating 4 hydration. Rehydration reduces blood viscosity, preventing further vaso-occlusion. D. Administering opioids as prescribed. Severe pain from ischemia requires prompt management with opioids. Incorrect options. C. Applying cold compresses. Cold causes vasoconstriction and worsens the crisis. E. Encouraging ambulation. Rest is crucial during a crisis to minimize oxygen demand and pain. Question 18. A 6-year-old child with hemolytic uremic syndrome, HUS, has a serum creatinine level of 2.1 mg per deciliter and is oliguric. What complication should the nurse monitor for? A. Hyperkalemia. B. Hypophosphatemia. C. Hypocalcemia. D. Hypernatremia. Answer: A. Hyperkalemia. Rationale: acute kidney injury from HUS impairs the kidney's ability to excrete potassium, leading to hyperkalemia, which can cause life-threatening arrhythmias. Hypophosphatemia, choice B, and hypocalcemia, choice C, are less common in HUS. Hypernatremia, choice D, is also unlikely, as sodium levels are generally normal or low in acute kidney injury. Question 19. A nurse is providing discharge teaching to the parents of a child with iron-deficiency anemia. Which statement indicates the need for further education? A. I will give the iron supplement with orange juice. B. I will increase my child's intake of red meat and eggs. C. I will limit milk intake to 2 to 3 cups per day. D. I will stop giving the iron supplement if my child's stools turn black. Answer: D. I will stop giving the iron supplement if my child's stools turn black. Rationale: black stools are a normal side effect of iron supplementation and are not a reason to stop the medication. The other statements reflect correct understanding of iron absorption, dietary changes, and managing milk intake, which interferes with iron absorption. Question 20. True or false? Children with sickle cell disease should receive routine prophylactic antibiotics to prevent infections such as Streptococcus pneumoniae. Answer: true. Rationale: prophylactic antibiotics, particularly penicillin, are prescribed for children with sickle cell disease because their splenic condition, loss of spleen function due to repeated infections, increases susceptibility to infections from encapsulated organisms like Streptococcus pneumoniae. Question 21. A 10-year-old with acute lymphoblastic leukemia, ALL, develops a fever of 101.5 degrees Fahrenheit, 38.6 degrees Celsius. What is the nurse's priority intervention? A. Administer acetaminophen to reduce fever. B. Obtain blood cultures and initiate antibiotics. C. Encourage fluids to reduce fever. D. Perform a complete physical assessment. Answer: B. Obtain blood cultures and initiate antibiotics. Rationale: fever in an immunocompromised child is a medical emergency due to the risk of sepsis. Blood cultures must be obtained before starting broad-spectrum antibiotics to identify the causative pathogen. While acetaminophen, choice A, and fluids, choice C, may be used to reduce fever, they do not address the underlying infection. A physical assessment, choice D, is important but secondary to initiating life-saving interventions. Question 22. A child with hemophilia presents with spontaneous bleeding into the joints. What should the nurse teach the parents to prevent joint damage? A. Encourage the child to perform gentle exercises during bleeding episodes. B. Administer clotting factor replacement immediately after trauma. C. Use heat therapy to reduce pain and swelling. D. Administer aspirin to manage pain. Answer: B. Administer clotting factor replacement immediately after trauma. Rationale: prompt administration of clotting factor replacement prevents further bleeding and minimizes joint damage. Exercise, choice A, and heat therapy, choice C, are contraindicated during active bleeding as they exacerbate the condition. Aspirin, choice D, is avoided due to its anticoagulant effects. Question 23. A child undergoing chemotherapy for leukemia reports nausea and poor appetite. Which interventions are appropriate? A. Provide small, frequent meals. B. Offer bland, easily digestible foods. C. Encourage meals rich in fats for extra calories. D. Administer antiemetics as prescribed before meals. E. Allow the child to eat in a quiet, pleasant environment. Answer: A, B, D, E. Rationale: A. Provides small, frequent meals, helps manage nausea and improves calorie intake. B. Offer bland, easily digestible foods, reduces the risk of nausea. D. Administer antiemetics as prescribed before meals, controls nausea, enhancing the child's ability to eat. E. Allow the child to eat in a quiet, pleasant environment, encourages appetite and reduces stress during meals. Incorrect option. C. Encourage meals rich in fats for extra calories. High-fat foods can exacerbate nausea and are not ideal for children with poor appetite. Question 24. True or false? In neuroblastoma, metastasis is common at the time of diagnosis due to the aggressive nature of the tumor. Answer: true. Rationale: neuroblastoma is often diagnosed at an advanced stage, with metastases to the bone marrow, liver, or lymph nodes. Early symptoms are vague, contributing to delayed diagnosis and widespread disease. Question 25. A child with hemolytic uremic syndrome (HUS) is anuric and showing signs of hyperkalemia. What is the nurse's priority action? A. Restrict potassium in the child's diet. B. Administer 4-calcium gluconate as prescribed. C. Encourage oral fluids to improve renal function. D. Monitor for signs of dehydration. Answer: B. Administer 4-calcium gluconate as prescribed. Rationale: 4-calcium gluconate stabilizes the cardiac membrane, reducing the risk of arrhythmias caused by hyperkalemia. While restricting dietary potassium, choice A, is appropriate, it does not address acute hyperkalemia. Oral fluids, choice C, are ineffective if the child is anuric, and monitoring dehydration, choice D, is not the priority in this situation. That's a wrap for Part 4 of our Pediatrics NCLEX-RN series on Pediatric Hematologic Disorders. If this helped, don't forget to like, subscribe, and share. Join me for Part 5, Cardiac and Circulatory Conditions, coming next. This is Nurse Marcia. See you next time and good luck on your NCLEX journey.